How you feeling?
I'm okay.
You're okay? What's today's date?
Today is March 13th, 2016.
2016? No, it's not. 2017. Crazy. Where are we going?
The chop.
What are we doing on chop?
Ed's second surgery.
Second surgery? Not the first one, the second? Yeah. How you feeling?
Tired. A little bit nervous.
A little bit nervous? What are you nervous about?
The unknown.
Unknown? Yeah. And that was the beginning of our journey to the surgery and to the hospital. Welcome to episode 2. Sorry for the noise of the air conditioner. I can't help it. It's really hot and the AC's on. The start of the journey didn't start that day. We have to backtrack 3 days prior to March 13th. When we got back from the hospital at the end of the episode 1, I showed you guys, we got back just 3 days prior. Then some other stuff had to happen. We had to give Ed a daily bath at night with these special wipes that are antibacterial. We had to give him mouthwash and wipe his cheeks and everything, and all this was the idea to kill as much bacteria as possible, so that when they finally take the scalpel and they cut down his chest, that there's almost no bacteria on the outside of his skin, so it can't go enter his body. Now that night, I actually slept pretty well. I don't know how Courtney slept in that night, but I slept pretty well. We started the journey down, we got coffee, we stopped at Dunkin' Donuts, got some coffee, drove down there, and pretty much, like, from what I remember, like, very positive vibes, very positive energy between both of us. But there's still that stuff that's in the back of your mind that now starts creeping to the forefront. You know, all these worries and stress about different things and the anxiety of what is going to happen. We never could have imagined what did happen. So when you get to the hospital, you start checking in, and you're checking in like you are just an outpatient, that you're just coming here for a regular checkup. It's very strange. You don't go into a special, like, surgical area. You're, like, literally there with other, like, heart patients. Well, these are all children, but you're there with other heart patients. I'm waiting in the waiting room, taking selfies of me and Ed, you know, just waiting to get called back. And then we finally get called back, and now you're in, like, the surgical prep area. Now, there's nothing really fancy about the surgical prep area. It's just another part of the hospital. It's a regular hospital room, except for instead of just like 1 or 2 beds that can handle, each like room area can handle like 4 to get ready. And everything after that is just paperwork, hitting certain benchmarks. You gotta meet the anesthesiology team, and you gotta sign that waiver and that consent form. Then you gotta meet the surgical team and sign that consent form. And then you meet your nurse that's gonna take care of your kid when they get back from surgery. And then she shows you where your room will be, or on the opposite side of the hospital, which is in the ICU. And then, you know, you start thinking about, like, well, okay, well, we got stuff downstairs. Well, what are we gonna do? Where are we gonna wait? You know, our parents are there. You know, it's like, okay, well, what do we do next? Where do we go next? What's going to happen next? And all this happens, and then finally the anesthesiologist comes in and starts wheeling him down. And that's where everything starts to really hit you.
Hi guys. We need another feeding tube.
Because I don't know how if other parents think like this, or if this is something common or not common, but like in my mind, I was like, you know, each time that happens, it hits me. It could be the last time I see him alive. And that's a very grim way to look at things, I understand, but when you look at the gravity of the situation, this is heart surgery. This is open heart surgery on a baby. It's not normal. I don't think it's okay to think like that too. It's being, you know, realistic. I can be optimistic, but still realistic, that there's always this threat. It's a bad way to live, in that always thinking that there's a threat that really could build up anxiety. But definitely when you see your kid wheeled down into the elevator and take him up to the surgical area, that's kind of how you think sometimes. After that, though, we got to meet with the surgeon, and she assured us that everything's going to be okay, just like any good surgeon would. And then the waiting game started. And at 12:30, he goes back in surgery. Every hour, we're supposed to get an update from our nurse. 1 o'clock, we get an update. 2 o'clock, we get an update. But then 3 o'clock rolls around, we don't get an update. And then it's 3:05, 3:10, 3:15, and you can see this is exactly how we the parents are looking at it. We're like, hold on, it's 3:18 now. Still no update. Okay, it's 3:21. But half hour afterwards, I go back into the ICU. I go try to find our nurse, and she's busy. She's doing her job, doing lots of work, trying to get the room ready. There's lots of things that need to happen. The room is sterilized. We have to get supplies for the cart, different syringes and medical supplies and medicine, and they have to get the IV cart ready, and they have to get the entire room ready. There's lots of stuff that these nurses have to do, and she just probably got caught up in it all. She saw me and she's like, oh shit. She said, everything's okay. I'm so sorry. Everything's fine. And he'll be back soon. They're closing up. And I'm like, okay. And that was at 3:30. Yeah, we got told to go sit in the conference room to meet our surgeon at like 4 o'clock. And we didn't meet our surgeon until like 5:30. Talk about some of the most stressful hour and a half of your entire life. When you're told to meet the surgeon in the conference room, that means that everything's done and like they're out of the OR. So then why did it take an hour and a half? Things happened. We still don't know exactly what happened in the OR that day. I mean, we could probably request the paperwork and really figure out what happened. I guess it really didn't matter in the grand scheme of things because the surgeon was like, it's nothing I couldn't handle. When we asked about it later, when we asked the attendings, even they're like, hey, like, you know, yeah, the complications that happened is something to be expected. And a lot of babies had those complications and we know how to handle them. But still, it does a number to you as a parent. And then that ends that night. I mean, that's pretty much, it was already, 6 o'clock, then it's dinner time. There's still nurses running around and every hour they're doing stuff, and Ed's heavily sedated with morphine and different other drugs to, keep him asleep so he doesn't, rip open his chest, so he doesn't start screaming, and so he's just comfortable. And we got ready for bed. He'd go to bed kind of late in the hospital, but Courtney and I wouldn't leave him. We wouldn't leave the room. Also, we really didn't have anywhere else to go. So I slept on this little couch thing. She slept on this recliner. We hid behind the curtain because both parents were not supposed to be there. They're allowed to have one, but not two. But we hid behind there. Then you just go through the night of being at the hospital. And as I lay there and everything, I start typing on Facebook to, inform all our friends and family about what happened. And this is what I said. Let's talk about Ed. Actually, I want to talk about sprints and marathons, but first, a status update. Ed went into surgery at 12:30 this afternoon and was done and ready to visit around 5:45. His surgery went well and his surgeon was very happy with the outcome. In total, his heart was stopped for 9 minutes to widen the hole between the right and left atriums. He was on bypass for a little over 40 minutes. The Glenn procedure was done, which disconnected the superior vena cava from the right atrium and connected it to the pulmonary artery. Even though the surgeon was very happy with the overall surgery, it does not mean there have not been any issues. As she said, he gave me some problems, but nothing I couldn't handle. A high fever, bleeding, fluid buildup, low oxygen, and a very high heart rate have been some of the issues. But it's not something that cannot be handled by us, Ed, or this amazing CHOP team. Right now, things are looking very well, and he is steadily improving with oxygen now at 75% and his heart rate back down in the 140s. But let us talk about sprints and marathons. I read an article Courtney sent me about single ventricle parents and how they said it was a marathon filled with sprints. I don't think there's a marathon runner in the world that would say that is wise. Yet, this really is how it is. We sprinted in our minds in preparedness for the first surgery, then to gain weight, to the second surgery. With this surgery passed, I am reminded that it is indeed a marathon and that it is not the end of surgeries for Ed. We still have one more a year and a half from now. The next 2 weeks can prove difficult as Ed starts to adapt to his new physiology. He could suffer from severe headaches and be very miserable. So we will sprint. Sprint to the point where Ed gives us a smile and sticks his tongue out. Once we get there, we can worry about the marathon. The next morning brought, pretty much the same stuff. And it's just kind of a lot of waiting game. And your family's there, both their grandparents are there, and, they all say stuff like, oh, it's going to be great, he's going to be fine, look at him, he's doing so well. I mean, all with, him in bed and, very bloated and, scar, sutures, holding his chest together. And this is not anything against that kind of talk or anything against her parents. What it is just talking about the fact that there's really nothing right or wrong that you can say in those moments. In those moments when someone is dealing with some very serious stuff, like when you're waiting for your kid to get out of surgery, everyone wants to say something comforting. Unfortunately, there's just not much things that comfort parents that are in that kind of moment. You can say anything that you want to. You can say, oh, it's going to be fine, don't worry, you know, I'm sure everything's okay. But all those things, unfortunately, hold little value and little weight to the mind and the comfort in actual parent, because you hear, oh, everything's going to be okay, and the first thought that comes in is the direct opposite. It's like, oh shit, what if it's not okay? I'm sure everything's fine in there, and it's like, oh shit, well, why is it taking so long? Maybe it's because something's wrong. So all these ideas, like, don't you worry, it's like, well, why wouldn't I worry? Like, my kid's in surgery. It's unfortunate that in crisis moments like this, there is usually never anything great to say, especially even more so for other people that are far outside. Like, it's one thing, it's our parents, Ed's grandparents are comforting us, support network, which was so vitally important for our mental survival through the you know, the course of the hospital stay. There's no way that we could have done it without any family support, and there's still no way that we could do it without any family support. But it's even so much harder for, like, you know, coworkers or friends and stuff. It's like, what do you say in those moments? And unfortunately, it's just that there's not much you can say. You can say, you know, anything you need, let us know. And that's usually some of the best things that you can say. And even though a lot of parents don't know what to even say to that, it's like, well, what do I need? You know, I need my kid to be not in the hospital. Or like, a lot of people want to offer food, and that's great. It is. Food's always good. It's a little tangent, I know, from the actual meat and potatoes of what the conversation's about, but it's something that just kind of happens. In shitty situations, there's usually not much you can say. But what you can do all the time is be present. And that's what our parents did. And it's hard to talk about and, like, not get a little choked up. There's no way that we would be able to do what we did for those days of surgery and the days after if it wasn't for our parents being there for us. And they didn't have to say anything. They didn't have to say any special words. They didn't have to have any special sentence to comfort us. And the only thing they had to do was to be present and be there and listen to us with our concerns. And so we can vent it out, so we can expel all those fears and the anxiety and the stress. And that's what they did. And there's only so much that you can, you know, expel to your partner, you know, to your wife, to the, you know, your husband. There's only so much stuff you can talk about because you both are talking about the same thing. But to talk to outside sources, they're not necessarily fully filled in, that can be that other ear, that can be that mirror, that, you know, to bounce ideas back, or just simply listen and agree with whatever the hell you say. But that is priceless, absolutely priceless. And all that, and why I'm talking about it so much, why I'm getting so emotional about it, is because that second day on March 14th, by just a little over 24 hours later, things took a turn for the worse. Let's talk about Ed. Tonight we fight until the morning light. I would love to say that the picture below is a 10 p.m. friendly huddle, but unfortunately it is not. What it is a team of 2 cardiologists, the head nurse, our nurse, 2 respiratory team members, and another doctor. This is the fight. They're all fighting for Ed. Nights like these are the ones unseen and not talked about that lead to our going home. Ed's heart rate skyrocketed from 150 to 190 in less than a minute and did not go down for 4 hours. His blood pressure nearly doubled from this morning to over 120. Screaming in pain even with 3 painkillers. Bucking against the crib bed. It is not pretty. The hard news is it looks like there might be some issues inside with his heart. His head has swollen so severely that he cannot open his eyes, and they are worried about his throat closing. He now has a scuba mask that is helping him breathe and sedate him. More to follow when the surgeon fills us in with her thoughts and plan.
But he can't wake up with